Stephanie. My name is student Dr. Vanessa Madsen, and today I see that you had a total knee arthroplasty on your right knee, and on your chart that I read that you have some posterior knee edema, so we're going to be addressing that today when we position and drape you, and also we want to increase that range of motion that your knee has. All right, is it okay if we proceed? I'm going to raise this bed up, and the reason why I'm raising this bed up is so I have proper body mechanics and I'm not flexing too much at my hips. This side of your bed rails, and so I have better exposure to this side, her right side of her body. All right, Stephanie, I'm going to lift up your sheets and expose your right leg here. Okay, I'm going to lift up your leg. As I do so, I'm going to widen my base when I'm standing. Maintain proper posture. Keeping a flat hand when I'm rolling this up.
You laid down most of the day yesterday.
Okay. Now I'm going to be floating her heels. When I do so, I also want to maintain this stance. That way my back, I'm not flexing too much and I'm more stable. Stephanie, I'm going to float your feet, okay? Remaining in this long-term position on your back, which is called supine. It can often cause pressure sores on your heels. Okay, so now that your heels are floating, I'm just to retuck, just to reevaluate and make sure everything is secure. Now to address your posterior knee edema, I'm going to elevate your right knee, okay? I'm going to slide this pillow underneath. Stephanie, I'm going to give you a towel just to also give you some more privacy while you're in this position. Drape that over there. Okay, and being in this position, it's really optimal, not only reducing the posterior edema that she's experiencing, but also this is going to allow your knee to kind of bow down slightly and create a greater range of motion for you. Now, Stephanie, are you comfortable in this position? Okay, awesome. And let me know at any time if you're not. You'll have this call bell while I leave the room, since you'll be in this position for long term. And also, if you could for me, make sure your hands are across your abdomen area and that your palms are open. Perfect. And please let me know if you get cold at all, because we can also add another sheet for your comfortability. And do you feel any pressure on your elbows or your shoulders at all? No. Okay, perfect. Well, if you feel like you have any increasing pressure, again, use your call bell to let me know. And before I head out, I'm going to be also raising that back up this bed rail, and then I'm going to come back to this other side here and make sure that her bed is lower. Because when you leave for a long term, you want to make sure the bed is low to the ground, bed rails are back up, and she's also centered in the middle of the table or her hospital bed. Okay, Stephanie, I'm gonna head out, and anything else you need from me, and are you comfortable before I go? Okay, thank you. I'll see you in a little bit. And you want to sanitize after working with a patient.